Hello, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center, coming to you from Chicago. We're at ASCO 2024. I'm here with Dr. Andy Brohl,
Hey, good to see you.
expert in sarcoma and Merkel cell cancer. So thanks so much for being here.
Yeah, nice to be here and good to have a nice ASCO.
Hey, so tell me what's going on in Merkel cell cancer.
Well, in Merkel cell cancer, we're mostly trying to figure out best how to optimize use of anti-PD-1 therapy, which has been a huge success for Merkel, but still is only helping about half the people with that disease. And so we're trying to look for what's going to be the best add-on, and for the patients who don't respond well initially, and even for patients that do respond well initially, there's an appreciation that, what are you going to do? What's your endpoint? If you stop therapy, there seems to be a risk of relapse afterwards that we have to figure out now how to deal with.
So what's new in investigational agents for Merkel?
Yeah, and so what, and actually, several of the abstracts are related to work that we've done here at Moffitt. One is an intralesional agent that we've studied in partnership with a company called Tuhura that is, they're calling an in situ vaccine, so it gets the bacterial protein into this cancer cell, which draws in the immune system, then gets it to react to other antigens in the area, and so hopefully sparks an immune response. We've seen a very nice, interesting early efficacy signal with this agent to the point that we're going forward with a registrational trial design in Merkel. It's big news for the field. Not too many of those happening in this rare cancer, so we're pleased to be helping lead that study.
That's wonderful. So it's a bacterial product that makes the Merkel cell cancer inflamed, looking very more immunogenic, and then that triggers the immune response against Merkel cells.
It's supposed to turn a cold tumor hot by drawing in the immune system with this bacterial antigen, and so far the data looks very promising. We've had a small trial, but 9 patients with Merkel cell cancer that were clearly PD-1 refractory before received this intralesional agent, then were rechallenged with the same drug class and had a very pronounced response. 5 out of 9 patients, so more than half of this small cohort with this really interesting but promising early efficacy signal.
So what's going on in the world of sarcoma? There's hundreds of kinds of sarcoma, right?
Yeah.
What's exciting here at ASCO 2024 with sarcoma?
I think sarcoma, and getting right to your point that there's so many different types, we're getting a little bit better gradually, year by year at distinguishing between these different sarcoma subtypes and trying to use different strategies to treat all these 100 different diseases. Historically they've kind of gotten clumped all together and given non-specific chemo, but now we're seeing some studies that are picking out certain types of sarcoma as immunotherapy responsive, so we can focus our efforts on immunotherapy on those few types, whereas others we're having a better understanding of the biology and looking for more specific targets for certain types of sarcomas, like MDM2 amplification in V. diff liposarcoma as a rational drug target for that one, ways to target fusions in the fusion-driven sarcomas. So I think we're seeing a bit of progress here in terms of developing more specific therapies for the more individual sarcoma subtypes, and that's what we're trying to move forward at Moffitt too.
Wonderful. Well, thanks, Dr. Andy Brohl, Merkel cell and sarcoma expert at Moffitt Cancer Center. Thanks for being here.
Yeah, thanks so much, Dr. Hwu. Yeah, appreciate it.